Welcome to HEALTHLINK TV show. I'm Stella. Today we are discussing vaginal yeast infection, commonly known as white. It is common among the youth and women in their reproductive age, and because the disease is poorly understood, most of them resort to all sorts of unorthodox way of treating it rather than going to a health facility for treatment. But today we have with us our health experts who will throw more light on it and clear every misconception about this disease.
Vaginal yeast infection is a common fungal infection of the genitals. It most commonly affects women, but men can get it too. 3 out of 4 women particularly are likely to have vaginal yeast infections during certain phases of life. Many women experience at least 2 episodes. A vaginal yeast infection isn't considered as sexually transmitted infection, but there's an increased risk of vaginal yeast infection at the time of first regular sexual activity. There's also some evidence that infections may be linked to mouth-to-genital contact. Stay tuned as we discuss what exactly is vaginal yeast infection, the symptoms, when it becomes complicated, when to see a doctor, the causes, risk factors, and how to prevent yeast infections.
Guess what? Dr. Bawa is here with us again. He's here to educate us more on white, locally known as Odepua. Doctor, you are welcome.
Thank you very much.
It's good to see you again.
Hey, nice to be back.
Doctor, what is vaginal yeast infection or Odepua?
So generally, the vaginal yeast infection or candidiasis or white is caused by a certain organism called Candida albicans.
Okay.
But generally, every woman or every human being, you have yeast all over your body, at every part of your body. So it's a normal flora, it's a normal organism in the vagina. But when, as I said last week, when the vaginal ecosystem is disrupted, such that you have more excess of this yeast in your vagina, that is when you develop the candidiasis, because the microorganisms, the abnormal organisms in your vagina, we call the lactobacilli, when they are disrupted, they are brought down. The balance, there's an imbalance between the fungal and the bacteria in your vagina, and that predisposes you to the candida infection. Before
we talk about the predisposing factors, who is at risk of getting yeast infection?
Everyone is at risk, or a female. So generally now we are referring to females now.
Yeah.
The females there are certain people who are at more risk compared to others. For example, an individual who is immunosuppressed as a result of taking some medications like steroids.
What's the meaning of immunosuppressed?
So immunosuppressed, your immune system is down. If your immune system is down, immunocompromised means your immune system is down. For example, if you are an HIV patient, you are a diabetic, or you are on oral steroids for a certain condition, your immune system is down. When your immune system is down, you are predisposed to this candida infection. Apart from that, generally pregnant women, when you are pregnant, your immune system tends to be compromised and you are predisposed to vaginal candidiasis. Apart from that, women or individuals who take oral contraceptives, they also are sometimes predisposed to vaginal candidiasis. Generally, women who also douche put certain things into their vagina that disrupt the vaginal ecosystem. It kills the lactobacilli that are supposed to keep the fungal in check. When you disrupt this ecosystem, you are then predisposed to this vaginal infection. And as we said last week, certain chemicals we buy from the market to tighten our vagina or give our vagina a very nice smell. All these things disrupt the normal ecosystem in our vagina and predispose us to vaginal candidiasis. So generally, vaginal candidiasis is not a sexually transmitted disease. You don't get it by having sex. It's just an overgrowth of the normal yeast in your vagina, no overgrowth, and that predisposes you, or that makes you get the vaginal yeast infection or candidiasis or white.
Dr. Bawa, what are some of the signs and symptoms of yeast infection?
So generally in the clinic, when you are there, you see the patients coming in. First of all, it tells you that I'm itching down there, dog, I'm itching. So number one of the commonest symptoms of yeast infection is itching. The people usually itch a lot. Apart from the itching, they will tell you they have a white discharge. And this white discharge is copious. It's chalky or cheesy in nature. You have this cheesy or chalky discharge, which is whitish, and usually very attached to the lining of the vagina, very adherent to the vaginal mucosa. Apart from that, some of these will tell you that I have severe pain when I'm having sexual intercourse.
So before you continue, you mentioned something like vaginal mucosa or vaginal line. Can you explain it more to us?
It's just the lining of the vagina. So you have this yeast infection very attached to the vaginal wall. So even though some of these discharge can come out, some of them are strongly attached to the walls of the vaginal lining. So that is on examination, but physically they will tell you that they have a discharge, and the discharge is very itchy. Some will tell you that they have pain when they're having sexual intercourse. And some of them, because they have scratched and itched the whole area, when they are urinating, when the urine passes through that area, it's like they are giving birth. It's very, very painful. Some of them actually cry when they are urinating. So because of that, they tend to hold the urine for a very long time. Because of the excoriation, the itching around the vagina and the vulva, when they urinate, it's very, very painful when they are urinating. And because of the itching and the scratching, they tend to be predisposed to other bacterial infections, even though the underlying cause is the yeast infection or vaginal yeast infection.
Can someone get vaginal yeast infection through sexual intercourse?
As I said, vaginal yeast infection is not sexually transmitted. So for a woman who has developed vaginal yeast infection, it's not a sexually transmitted infection. So it's very unlikely that it's a man that has transmitted a yeast infection to a woman. No. Even though vice versa is possible, but commonly yeast infection is not a sexually transmitted infection.
And does the discharge has any smell?
Generally, yeast infection doesn't smell compared to some infections like bacterial vaginosis or trichomonas infection. Yeast infection is not foul smelling, it's not fishy, it's not malodorous. You just have a discharge with severe itchiness, and it doesn't have a foul smell compared to trichomonas or bacterial vaginosis.
So doctor, what kind of tests will be done to rule out vaginal yeast infection?
So generally when the woman comes with a history of an itchy vaginal discharge, which is whitish, we as a doctor, you have to examine. So when you examine, you find out that most often there's associated itchiness. So the whole vagina is red. You might see some red patches from repeated scratches. You can see the discharge. If you pass a speculum is something small we put in the vagina just to let us see deeper into the vagina. You can see that we have a white discharge. The discharge is like a cheese or chalk. So with this discharge, you can take a high vaginal swab. We take a swab, a small sample of this discharge to the laboratory. We take it to the laboratory under the microscope. We're able to see that this is clearly a yeast infection. And we diagnose that it's a yeast infection. The treatment is very simple and straightforward. Even though there are some women who would come back with repeated infections. But once you diagnose that it's a yeast infection, the management is very, very easy and straightforward.
Doctor, so if you share a washroom with someone having yeast infection, can you get the infection?
So generally, as I said, the yeast infection, number one, it's not a sexually transmitted disease. The second thing is that it's not contagious. It's not something that can easily be transferred from one person to the other. It's not a contagious infection. But that being said, anytime even you are using a public toilet, it's still advisable that you make sure that the area is clean. The personal hygiene involves that even when you are sitting in the toilet, make sure the area is clean before you use it. Even it's even advisable to flush it even before using it. But in principle, the truth is that yeast infection is not contagious and it's not sexually transmitted.
What about the KVIP, the local toilet?
Oh.
Can the heat cause vaginal yeast infection?
No. The heat doesn't cause yeast infection. The heat from a KVIP generally should not be able to cause yeast infection, or doesn't cause yeast infection. It's not a known cause of vaginal yeast infection.
All right. And in case I don't treat myself or I don't come to a health facility for treatment, what are some of the complications that can happen?
So yeast infection, as we talk about, the first thing is that when you're having this discharge continuously, you are going to have itchiness all around your vagina and even your cervix. When this itchiness continues, there's inflammation in your vagina and there's healing, and the healing is usually not good and heals by fibrosis. So it makes your vagina very rough and when this continues for a long time, you are going to have a bacterial superimposition on the vaginal infection. So the discharge is going to be foul smelling, brings down your self-esteem. And when this goes on and you have a systemic fungal or yeast infection, systemic means this thing can get into your bloodstream. When it gets into your bloodstream, the treatment is even more difficult. You are going to require oral medications to treat it, and it's usually not the best. Apart from that, it makes you generally uncomfortable as a woman. You getting up almost every hour to go to the washroom just to change your underwear, a discharge coming all the way to your legs, you itching all over every time. It's usually not the best. So the earlier you get treatment, the better for yourself.
But then can Odepoa affect fertility?
Odepoa, no, generally shouldn't. It doesn't affect fertility. The STIs are ascending infections that called pelvic inflammatory disease and can result in infertility. But Odepoa or white is not a known cause of infertility.
So Dr. Bawa, what's the difference between the oral candidiasis and the vaginal candidiasis?
So oral candidiasis can affect everybody, not the vaginal candidiasis is restricted to only females, but oral candidiasis typically affects people who are immunocompromised and children, because in children your immune system is not very well developed. So if you are somebody whose immune system is not also strong, for example an HIV patient, you can have an oral candidiasis. Somebody who has been on steroids for a very long time, steroids are medications that suppress your immune system. Some ladies now also take steroids to make their skin lighter, bleach their skin, or tone their skin. That can also give you oral candidiasis as well as vaginal candidiasis. People on chemotherapy drugs for treatment of cancer, their immune system is also suppressed and can also develop oral or vaginal candidiasis. Diabetics who are uncontrolled can also develop oral or vaginal candidiasis. So those are generally, if your immune system is suppressed, and in kids and children, they tend to have oral candidiasis. But that is their treatments are different from vaginal candidiasis to some extent.
Can a woman having vaginal candidiasis transfer it to a man? Okay,
so it's possible, even though it's not common, but the woman with the vaginal candidiasis can pass it on to a man, especially if the man is uncircumcised. If you're uncircumcised, the foreskin around the penis, the area is very humid. So people who are uncircumcised, males who are uncircumcised, tend to come to the hospital with a lot of candida infections because they have the foreskin. The foreskin is very humid, it has a lot of moisture, so it's a good medium for fungal growth. So men who are uncircumcised tend to develop candidiasis in their penis or around their foreskin. But generally men who are circumcised rarely, or it's very uncommon for you to develop candidiasis if you are circumcised.
So doctor, do they experience the same signs and symptoms like the woman?
So for men who have the uncircumcised men who have the candida infections, so they generally do not have a discharge, but you see a whitish layer around the foreskin, and they usually find it difficult to retract the foreskin back, especially when they want to have a sexual intercourse. So it's usually they come in with pain and itchiness around the area, and when you open it, you see a discharge around the area because the foreskin is very adherent. The candida is between the penis and the foreskin, and it has made it very tight. So their presentation tends to be a little different from the women.
And doctor, I want to find out, how is yeast infection treated in the health facility?
So yeast infection, because it's fungal, is treated mainly with antifungals. These antifungals either come in as oral or pastries. Pastries are tablets in which you can insert into your vagina. So for a routine yeast infection, depending on whether it's just a yeast infection or it's together with other infections, there are pastries we can give you for a number of days to treat it. There are some we can give oral for you to take and it will eventually clear it. So the treatment is either through oral tablets or pastries you insert to see them.
And can a virgin use the pastries?
So generally, most practitioners will prefer to give orals to someone who is not sexually active compared to the pastries.
Viewers, you are watching HealthLink TV show and we are discussing vaginal yeast infection, commonly known as white. We'll be right back.
when we talk about white is something that most ladies experience that, and then it's common too. But then when it comes, you have to treat it very early. Other than that, it will just it will graduate to a different disease that if you don't take it, you'll not be able to treat it. You will be able to do it, to treat, but then it will worry you. It will take some time before you get rid of it.
And you know, my dad don't have toilet. I also any other so can be abedun so e kan ho o panty abehye di wa be se dinini na masa na me nyina bayase.
Me mo ho white. Me wo se masika me ye won water. And I'm a dinchine. I dance in the boom. Made the washing must buy 3 days mental.
Yeah, I know about vaginal discharge. She's the one she have to tell you about. Yes, if she tell you, then you tell her. So you should go to hospital to see a doctor. Okay. So the doctor will decide the medication she will give her.
I know that sometimes it can be yellowish, and then if it's not treated well, it will grow to gonorrhea when you have the thick discharges. I bought this. It was a certain drug. It was like a tablet. It wasn't a tablet. You insert it 3 times, like a night, 3 days. For 3 nights, 3 nights, and then that is all. Finally, I went to the pharmacy to get a drug, but we have to report to the hospital to know what exactly is wrong with us.
Yeah, me no. Obi di me ko hospital. Yeah, wo me panie. You treat me who be ma to say me say me first once and me expensive but me we and one maybe.
Why did you almost say or baby be one home? By do sometime what who be by do maybe I won't say biba. Was a kawana bibisa. And me who be there by young bass and I said, I drove in my pan man, my pedrobiano. Me got red and yellow near she grown man, no jay.
Welcome back. We've been discussing vaginal yeast infection. Doctor has said a whole lot about it. Now let's move to the prevention of vaginal yeast infection. Doctor, so how can one prevent vaginal yeast infection or white?
So the prevention, just as with abnormal vaginal discharge, is good personal hygiene. The first thing is that for a woman, make sure that your underwears are cotton. When you wash them, make sure they are dried in the sun, because when they are humid or wet, they create a good medium for fungal growth. A good medium for fungal growth, you will develop yeast infection. So make sure you wash your underwears, they are cotton, dry them in the sun. If you can even iron them before putting them. Apart from that, avoid using irritants or certain chemicals or douching, putting them into your vagina to give your vagina a nice smell or to tighten your vagina for pleasurable sex. All these things disrupt the vaginal ecosystem. When you disrupt the ecosystem, it gives a good medium for fungal growth. Apart from that, we have to make sure that we avoid antibiotic abuse, especially the broad spectrum antibiotics. You go to the chemical shop, they said you have this, they just give you Cipro. These are broad spectrum antibiotics that kill both the good and bad organisms, some of which are found in your vagina. So when they kill these bacteria in your vagina, it makes the fungal, there's no resistance, so the fungal overgrow and you eventually develop candidiasis. Quite apart from that, if we have any systemic condition like diabetes, like HIV, let's make sure we see our doctors and be regular with our medications, because if your blood sugar is well controlled, you're unlikely to develop that. If your blood sugar is not controlled, it's always ranging very high, between 15, 16, 20, your risks of developing these yeast infections are high. People who are HIV, AIDS, and are on medications, they are taking their medications well, they do not have problems. But if you are HIV, AIDS, and you default treatment, you don't take your medications well, you are very likely to develop. So please, if you are HIV and HIV AIDS patient, make sure you are compliant with your medications, take your antivirals very well, and it's unlikely that you will develop any complications or have yeast infections. These are some of the preventive modes of vaginal yeast infections.
And how can one prevent herself from getting reoccurring vaginal yeast infection?
So the reoccurring vaginal yeast infection occurs especially when people go to the hospital and they give them a course of medications, they take 1 or 2 tablets and do not finish the course because the symptoms have stopped. Maybe they give you a pessary to insert for 5 days. After the first 2 days, you see that the women, they get better, the discharge has stopped. But that's not the full course of the treatment. So please, when you go to the hospital and you are given a treatment course, make sure you finish the treatment course before you come back. Sometimes when you are treating, the doctor advises you about this personal hygiene and making sure your underwears are clean and things. You do it for a brief period. But after 1 week or 2 months, you go back into the old habits again. You wash your underwear, put it in the bathroom. It's not well dried, you put them on, and you predispose yourself to these conditions. So if you are able to eliminate the risk factors or the causative factors, you are compliant to your medication whilst you are treated, it's unlikely for you to develop, get a recurrence of yeast infection.
Dr. Bowell, so can you just walk into any nearby pharmacy to get over-the-counter drugs to treat this condition?
So generally it's not advisable because you first have to make a very good diagnosis before you get to the treatment. You're having a discharge. How sure are you that it's white in the first place before you get to the pharmacy to get this treatment? So the best thing is to come to the hospital. For all you know, the whitest discharge might not be white. It could be even a normal vaginal lesion. For all you know, it's a sexually transmitted infection that has to be investigated well and treated. But you go to the pharmacy, maybe you say you're having a discharge, they are assuming that it's white. For all you know, it might not even be white. So you get these over-the-counter medications, you take them for a week or 2, find out that things are not still working out and you end up in the hospital. So why don't you come to the hospital in the first place, get properly investigated, the diagnosis confirmed, then you are treated. So we don't encourage women going for over-the-counter drugs, especially knowing how sensitive the vaginal is. The vagina is a very important organ in the female, so we have to treat it with the respect it deserves.
Thank you so much for educating us on vaginal yeast infection, which is white. We are very grateful to see you again.
Thank you, and I'll always be available to help educate the society on female reproductive health issues.
So doctor said we shouldn't use over-the-counter drugs to treat white. Seek medical attention when you experience any abnormal discharge or you think you have white. Thank you so much for watching HealthLink TV show, and special thanks to Crown Medical Center for supporting this show. See you next week. Bye-bye.